First News with Keeler in the morning on WIBX and WIBX950.com.
On the line right now is Dr. Kent Hall from MVHS. He is the Chief Physician Executive who's been with us when it comes to the COVID issue for now longer than a year. We're still talking about it, and it's still pertinent because of the Delta variant and the number of people who have not gotten the vaccine. Dr. Hall, good morning. Thanks for coming on.
Good morning. Happy Monday.
Happy Monday. Okay, so do you have any idea where you are right now at MVHS?
So I don't have today's numbers, but as of over the weekend, we had 11 positives.
Okay, that continues to grow.
Yeah, if you think about it, back on the 4th of July, so, a month ago, we were down to 0.
I want to ask you, though, we in December and January, the numbers were really high. And at one point, I think you had 160 COVID-positive patients in the hospital, but never had to, we still didn't close down then. Commerce didn't close down. There were restrictions. And I believe that some of by January, I think you were still doing elective procedures. Is that correct?
No. So actually, on January 11th, we hit our high at 246 positive patients within the Mohawk Valley Health System. We were not doing elective procedures at that time because we needed to really focus all of our resources on taking care of all the patients that we had. We had over 400 patients within the system. So, and like I said, more than 50% of them were COVID patients. So we were not doing it then. Although you're right, from a community standpoint, we did have significant restrictions. I mean, in terms of. Yeah. What could be done, everybody's wearing masks and, what could be done in terms of getting people together and things. And obviously those have been loosened up somewhat, actually fairly significantly. Thankfully, at the same time, we have, close to 70% of our adult population has gotten within our county has gotten the vaccine. So.
Yet 11 in the summertime. This is the time where we would expect to have our numbers at their lowest. It's got to have you thinking that at the very least some concern about the possibility of fall and winter getting bad again. And then, maybe, last year they talked about this, the flu combined with COVID. We were going to get a double whammy, and we never did. But remember, we weren't out doing a lot of different things or inside doing a lot of different things. What are your fears going forward?
No, I think you make a lot of good points, and they are exactly the things that we are thinking about. In fact, we are pulling together our, for lack of a better term, our task force to see where we are, make sure that we have everything that we believe that we'll need from a PPE standpoint, from a testing standpoint, both for COVID and for the flu. So we are well in preparation, and we're trying to gauge, how many patients we think we'll end up with, understanding that's, that crystal ball, everybody's crystal ball is pretty foggy on that. But we are aware that, the trajectory of this is probably going to be upward. In fact, I would say, I would almost guarantee that that's going to be the case. And I don't usually guarantee a lot of things. Yeah. And so we are definitely it isn't so much preparation because we feel we are prepared. It's really just evaluating to make sure, are there any things that we should be looking for now in terms of, excess equipment and things. We don't think so, but until you actually do a deeper dive, you're not 100% sure.
Yeah.
Dr. Hall, do you anticipate any changes to visitor policy or visitation due to the increase in patients?
So we're not anticipating any changes in the visitor policy at this time. Obviously, we will be looking at that and seeing if there is a change. If we see a huge influx in the number of COVID patients, then we may need to make some adjustments. But at this time, we're not anticipating it.
And it does seem that I don't know that I don't know how we'd ever present another lockdown like we did in March of last year. And so I don't anticipate that. And when you hear from the governor, I mean, whoever our governor is going to be eventually, when you hear from officials, there seems to be no plan to do any closing down again because I'm not sure the economy can handle it. So going forward, though, I do think there's a public confidence that could become a problem. And I think I'm already starting to see it a little bit with so much talk about the variant. I'm seeing more people wearing masks inside stores, inside a grocery store, and that sort of thing. And then as this thing begins to spread and those who are vaccinated are testing positive, public confidence could be the problem. Not a shutdown, but people not willing to go out and spend the money that they kind of feel like they've been able to do with the vaccine this summer.
Yeah, no, I think you're exactly right. And I've been doing a little bit of, research from a historical perspective, looking at the 1918 flu pandemic. And it's interesting, there's a lot of similarity in regards to how we, the population, responded in 1919 and early 1920 compared to what we're doing now in terms of, they had pandemic fatigue at that time also. And understand they also were, at the end of World War I.
Right.
And so, there was a lot of, we just want to put the 1910s, the 19 teens, behind us. And so there was a lot there, too. The interesting thing was, and this is still not 100% understood, but for whatever reason, that flu pandemic tended to die out on its own to a very great extent. Not exactly sure why. It may be somewhat related to development of herd immunity. Yeah. Probably World War I the end of World War I had something to do with that because we weren't so confined.
Right.
But it is interesting that from a human social psychology standpoint, the same thing in terms of we just want to put this behind us.
Yeah.
We were lucky in that regard. I don't know what's going to happen. This is a different virus. It is not a flu virus. I want to make that very clear. So, what is going to happen, and especially as these variants come out, is going to be is still yet to be defined, and that's why keeping our vigil up while it is frustrating and tiring and all that is also really very important.
30 seconds.
I just want to give a little perspective on the numbers locally. Oneida County on Friday, the last day of numbers that we have, they didn't put it out over the weekend, but on Friday, 33 new cases in Oneida County. That was the highest single-day total in 2 months. That dates back to early May. And then in Herkimer County, they had 18 positive cases announced on Friday. So the local numbers are certainly ticking upward.
And that's for Herkimer County, that's kind of a high number even during the pandemic.
Yes, it is.
That was high. So, all right, Doc, we appreciate the time as always, and we'll do it again. Thank you so much.
Sounds good, everybody. Please be safe and have a great week and be cool. It's going to be hot this week.
Yeah, thank you so much.